into the drill holes. So the dowel pin is again of single dowel pin or dual dowel pin. So dual dowel pin will be of more advantages in case of it will prevent the rotation of the dies after sectioning. So additionally, what we can do in the lap side, in the base of in the reverse side of the cast, we will be giving a groove on the help of the straight measure board. So it will also prevent the rotation of the die after sectioning. So as I mentioned, we will be locating the exact location where we are going to drill it with the help of the light, and then we will be downing the lever. So once it is done, here we use double plate with a common head. So it is pushed into the drill hole, and the rest of side of the plate it is routed. Okay. So if you want, you can give an extra grooves on the either side of the die. That is the exact position of the dowel pin, so that it will prevent further rotation of the die after fixation. So once it is done, you can place a metal sleeve or a rubber sleeve based on the die system you are using, a dowel pin system, and there will be a plastic cap. So the plastic cap is to remove it after the base is poured, and then you can press with the help of the axis behind from it, so the die can be popped out. Okay. So once that is done, then you will be pouring the base. So next, after the base, then we will be pushing on the die sectioning machine, and then you will be orienting the cast so that it will not affect the other two surfaces. For example, you are going to cut it here, then with this saw should not cut the opposite side also. Okay, so you have to orient in such a way that it will not damage other parts. So once that is stabilized, you can fix that the platform, and then it will be rigidly fixed, so it will not move. So then you can press the button so that this will start rotating, and you can down the lever so that you cut the exact desired part. For condition where that is damage touches the surface, you can use the hand saw also, so that you can carefully cut it, and then you can cut up to 3/4 of the entire length, and then you can break it slightly so that it will not damage further. So this is a section cast. You can visualize that it is all parallel. It is not it's not tapering or something. So it's very easy. For example, if the die section is not done properly, if it is reversed, for example, the base is more wider and upper surface is more narrower, then the die section to die cannot be retrieved from the cast. So the parallelism is very important, and moreover the position of the die pin, that is dowel pin, what you kept it is very important. If it is not kept properly parallel to the long axis, the die cannot be retrieved from the cast. Okay. So once the die section is over, you can retrieve the dies and you can use it for the complete seating of the die. Then the ditching. So what is the need for ditching? So basically to expose the margin. So margin is already exposed with the help of the retraction part, but still we want to delineate the margin clearly so that we can finish the wax pattern to the perfect adaptation. Why? Because the adaptation is more important. If it is not done properly, then the fitting will be compromised in the patient's teeth. So again, there will be chance for cement dissolution, secondary cases, all those things will happen. And moreover, this what we are following is a conventional method. As you know, the advancement of CAPCAM has overcome this laboratory steps. So because of these shortcomings, we have to more clean about this lab procedures. Why? Because if this is not done properly, we will tend to chance to miss out the margins. So we'll be doing either short wax pattern or an proper ill-fitting margins of wax pattern. So ditching has to be very carefully done. This has to be done 1 mm below the finished margin. Okay. So it can be done with the help of the acrylic drilling burr also. Otherwise you can use a brown burr. So you can gently do the ditching along the 360 degree along the finished margin. So once that is done, next we will be highlighting the margins. Why? Because we are going to flow the wax on the die. So we want to inspect that whether that is flowed properly or not. Maybe some areas it may not flow properly. So to verify that, we have to first highlight the margins. So while highlighting also, it is very important that the color what you are going to use is going to influence the final outcome. Why? Because the same color of the wax what I will use for red margin wax is going to use for margin. Same color we are using, we cannot be able to differentiate it. So the different color has to be used. And one more thing, the dye pencil what you are going to use, for example, carbide and some graphite pencil you are going to use, it will abrade the surface of the finished margin. So that cannot be used, and also it will act as anti-flux. So the passing will not flow properly into that particular margin area. So you have to use an organic pencil for this. So once that is done, you can apply dye hardener, because you are going to fabricate the wax part and you will be removing and you will be placing it again and again. So that will decorate the surface of the dye. So you can use an dye hardener. Then you can apply the dye spacer. Dye spacer is basically to prevent the hydraulic pressure build-up during cementation, and also provide a space for the cement. So dye spacer, again, the dimension of the thickness of dye spacer is decided based on the cement what we are going to use. So this has to be decided in advance. What type of cement you are going to use for cementation, that will also play a major role, because the thickness of the cement will determine the thickness of the dye spacer. In case of CAD/CAM, you can design the gel buff tool, so you can determine the exact position of the dye limitation, spacer limitation, and also the thickness can be designed in the CAD/CAM tool itself. But here you have to apply manually, and dye spacers are available in different colors. So, for example, based on the brand, it will be varying from silver, gold, red, and blue. So, what thickness, final thickness you are designing, you can choose the dye thickness accordingly. For example, this silver color will be ranging from 6 micron. So, for example, you are going for 35 micron cement space thickness, you can apply that number of times of dye spacer. Okay? And dye spacer application, it has to be 1 mm short from the finished margin. Why? Because the critical area is 1 mm, that is going to have a proper tight adaptation of the ground to the prepared surface. If that is compromised, then the cement dissolution is definitely going to happen. Again, the success rate of the ground is compromised. So that has to be taken care properly. So we are going to demonstrate the wax pattern for the 3-minute bridge. And as you know, there are different wax materials are available. So one will be dipping wax, and then next will be a marginal wax, and third one will be a crown wax. Okay. So we will explain about that. So to understand the wax pattern, there are two different types of appraisal schemes existing in our natural application. So one is the cusp to marginal ridge relationship, and one more is the cusp to fossa relationship. So cusp to marginal ridge is a self-explanatory one. It's easy to understand that there is a relationship between the cusp and the marginal ridge, and also the fossa. In case of cusp to fossa relationship, only there is a contact between the cusp and the fossa. So this type of relationship is existing in natural condition in 95% of the population, cusp to marginal ridge and fossa. But in case of cusp to fossa, is one very less number of existence. And that is this is advisable for a single or a fused long span of FPDs. But in case of cusp to fossa, that is advisable for full mouth rehabilitation. Why? Because cusp to fossa is easy to achieve and also is more stable. And the advantage of cusp to fossa is you can direct transversal forces along the long axis of the tooth, and also the relationship is very stable. So that is easy to achieve also. In case of full mouth rehabilitation, we will be going for cusp to fossa. For a shorter span MPD or single tooth restoration, we will be going for cusp to fossa and marginal ridge relationship. So if you see here, there is a region for the mandibular molar is having contact with the marginal ridge, and also there will be contact with the fossa of the opposing tooth. So here the contact will be between the tooth to the teeth. There is a tooth to a two number of teeth. But in case of cusp to fossa, there will be tooth to tooth contact. Okay. So if you see there is a tripod contact, the cusp will be contacting in the inclines of the cusp, not in the cusp into the fossa actually. So there will be contact between the cusp of the lower to the opposing wax pattern or the opposing teeth in a 3-point contact. So that will be a more stable also, and there is a tripodal contact, and also in the margin ridge. So this is a cusp to fossa, and then also the margin ridge. And cusp to fossa relationship, as I told, is only cusp to fossa relationship. It is more advisable for a full mouth rehabilitation. And also you have to evaluate whether the patient is falling in a cusp to margin or a cusp to fossa relationship. Accordingly, you can be able to do the vaccine. We cannot convert a cusp to fossa to a cusp to margin relationship with the existing patient. Okay. So as what I explained is same. This is only contact in the inclines of the cusp, or also in the cusp tips. So cusp to fossa relationship. There is no contact in the margin ridges. Okay. So we will be demonstrating about the dissection, and then we will be proceeding with the last part. Any doubts in this? Basically, it's very simple only. If you are doing difficulty, it will be very easy. First thing, you have to pour the impression properly. Impression pouring is based on the dye what you are going to use, dye system. So So after mooring, then you have to section the die, and you have to regain you have to do the trimming of the ditching of the finish line, and you have to highlight it, and you have to apply it. Even after highlighting, you can apply sign of print on the margins of the finish line so that it will not upgrade. Then you can go for an die hardening and then die spacer. Then you will apply die lubricant and then you will fabricate the wax pattern. Okay. While establishing the wax pattern, only there are two types: first to margin and closer, and only first to closer relationship. Okay.
நீங்கள் பண்ணதெல்லாம் நீங்கள் டபுள் பென்ஸ் வச்சுருக்கீங்களா இல்லை அப்படியே அது தனியாக வருது
அதோட தான் எடுக்கணும். அதில் எல்லாத்தையும் எடுக்கும்போது மேக்ஸிலால் மட்டும் தான் வச்சுருக்கேன். மேண்டில் அது கொடுக்கல அவங்க
காலேஜில் கொடுத்தாங்களா? பரவாயில்ல வச்சுருக்கீங்க இப்போ வச்சுருக்கேன் அப்படியே அதில் வச்சுருக்காங்க.
அது டைம் கிடைக்கல. மேக்ஸில் மட்டும் தான் ஃபஸ்ட்டு ஸ்டார்ட் பண்ணுறேன். நிறைய வச்சுருக்கோம். டபுள் வச்சுருக்கோம், சிங்கிள் வச்சுருக்கோம். அவங்க ஹேண்ட்ஸ் வாங்கியிருக்காங்க. நான் வேலையை இது வரைக்கும் கட் பண்ணிவிட்டு அந்த இதை ஃபுல்லாக வீடியோ தான்
40, 100, what is the contact? It should be less or more? Yeah, less. So you have your Bosch, okay, you have 8 micron, you have 12 micron, you have, what is this? 100 micron, and your metallic is 12, okay? And then you have your 200. So these, what is required is to your 11 micron, 12 micron is for your implant. So your natural tube should be about, can be 40, hold a 40, but this should hold only a 12 micron paper, okay? Yeah. You have paper. Yeah. So now the burr dictates the amount of taper and amount of tool dimension. Okay. So that you need to identify, because most of the companies that will say this number, you go by number, 171, number 12, number 13. So these are numbers varies with the company. So what you really have to do is use a caliper, the metal caliper that normally we use for evaluating the thickness of a casting. Okay. For all preparations, we are going to use only a tapered, rounded taper. Okay, there's no flattened taper indications anymore. Even for all ceramic, it's a radial chamfer or a heavy chamfer. Yeah, okay. So use a metal caliper and you personally evaluate the thickness of your diamond. Okay? Yeah. Okay? So these are Mani bulbs, I think. So TF is what? Tapering? Flat. Okay, flat it, okay. Here. Here. So you can use TR13. TR12 is there. Okay. So what I would suggest is get a corresponding yellow diamond, which is a finer diamond. You can use it for finishing your preparation. Okay. The concept of a smooth preparation is important. The casting has to be roughened, not the preparation, because even if you have a rough preparation, the impression is going to be recording only. When it records, the cast will not be poured completely. Okay, you're going to fill it up with a die spacer, so it doesn't make any difference at all. So for all practical purposes, make the preparation smooth as much as possible. Okay. So what the diamonds are going to use? You're going to use either a 12 or 13. Okay, we will see with the divider. I mean not a divider, caliper. What is the thickness of the diamond? Okay, and then you have to have a proximal diamond, which is thin, okay, which is tapered fine diamond. Okay, we can use a thin needle, it's called a needle diamond. If you can lay your hands on a torpedo burr. What is a torpedo burr? It's a chamfer burr, okay, or a diamond, which will have a parallel wall. Only the tip alone is going to be 45 degrees taper. Okay, so let's open a diamond now. Yeah, the beam. want to go to ceramic course, you can do the full coverage. What do you placing? You want to do a shoulder, you want a shoulder preparation or a wing preparation or a full shampoo? Full shampoo.
இல்லை மெட்டல்ஸ் பண்ணிக்கலாம் ஆனால் உடனே சொல்ல பிளாஸ்டிக் டைப் பண்ணி வேண்டாம்
ரவுண்ட் டைப் தான் யூஸ் பண்ணுவோம்.
தான் யூஸ் பண்ணுவோம்.
What purchase are there today?
டார்பிடோவா யூஸ் பண்ணணும். டார்பிடோ
What did the speaker tell today, Dr. Sharmila ma'am, for posterior? Okay. Okay. So normally, you don't talk about the textbook doesn't talk about an occlusal ceramic. So we have to give a chamfer on the lingual aspect and the labial aspect of shoulder. So you end up with a wing preparation. Okay. But it's very difficult to give a wing preparation as a practitioner. Okay. So normally we give a full chamfer shoulder ceramic. Okay, so then we'll stick to the conventional then. So you'll have a chamfer on the lingual aspect and a shoulder on the buccal aspect. The shoulder provides thickness of the ceramic as well as the metal. Okay? Yes. So this is PR13. So we go by the tip. The tip decides the see how much is it? The tip is right. You get it right. Okay, that's 1 mm. Can you see that? There's 1 mm at the tip. Okay. So how much of preparation you will be ending up in this finish line?
1 mm.
1 mm. Do you see the entire diamond or half diamond?
Half.
Okay, then how much will be that? 0.5, right? Is that enough for a chamfer?
No.
Yes? Yes. So let's see the next diamond, which is, and let's see the towards the shaft. How much is that? 1.5, right? It's almost, yeah, a little more than 1.5, right? It's almost 1.5. Okay. So the 13 is 12. We'll see how much it is. It's less than 1. It's almost, yeah. And then, yeah. So that's the difference between 13 and 12. Okay. So which will reduce less? 12 or 13? 12 will reduce less of tooth structure. Okay. So let's go by. So we will restrict our chamfer to 12. Okay. And our shoulder we will use a 13. Okay. Okay. Sterilize. And the instruments before I start. Okay. So I have another set of instruments. Okay. So this is the what mouth mirror is this? The mirror is what are types of mirrors you have? Mouth mirror. Huh?
Concave mirror.
Which surface reflects? The front or the back? What is the problem with the okay. Okay. So it's preferable to have a what mirror? A front reflecting mirror. Okay, because that will the magnification, the errors will be less. Okay, so you can try to get those, hand of those in the when you're going for conferences. there are two periodontal instruments, exploring instruments. So what is the difference between this and this? What is this called and what is this called? The one on the left hand, one on the right hand. The left is called explorer. So what is it used for? It's called as an explorer. You're trying to explore with it, right? So what do you explore?
Caries.
You explore the caries, you explore the margins, and all that can be done. This is to probe your, what do you probe with this?
Depth of gingiva.
Anything else you want to do, you use the probe. Okay, so this is only for exploring. Okay, whether the cavity needs to be restored or all that, you can use this. And where the fissures, they are caught pattern. I'll show you everything so that it's easier. Okay? I think one is from Dispo type, no? So it's the cord packer. So you can use, the cord packer has a serrated margin so that it can push your cord into it. Okay? And this is your backplate holder. What is that called? Yeah, Miller backplate. And then your cords, okay?
800.
The cord varies, okay? You have 000, 00, 0, 0, 1, 2, 3. What is this, you know?
Thickness of the cord.
Okay, so it varies. 00 is what? How much? 10, 3 inches, right? 103 inches. So accordingly it varies. So let's move on to the clinical. Any questions? We go to the clinic.
Patient account. Exam
Double layer mask. This corona mask. Actually, you have a white and a colored layer, right? So you know the difference. When do you use the white? What should face you? The color faces you because the filter is you're not going to transmit. If you are infected, then you will wear the white inside. The white contains a filter, so the filter is you're filtering it and then you're inhaling, not inhaling and then filtering it because it gets held in your oral cavity in your mouth itself. So always the color goes in. Okay, if you are not infected. If you are infected, the color comes out. Okay, this is all part of NABH training. Hey, you had to follow us.
அது போய் சொல்லவே கேட்டாங்க லூப் எக்ஸாம்பிள் லூப் போட காசு எப்படி இருக்கும் வெளி கிரகத்துலேருந்து வந்திருக்கோம் எனக்கு தெரியும் சார் அவங்க எப்பயுமே எக்ஸ்ட்ராடினரி ஸ்டூடெண்ட்ஸ்.
And if you are using latex gloves, kindly large.
நீ கரெக்டாக தான் யூஸ் பண்ணுவாங்க ட்ரை பண்ணுறேன்.
7.5 or large gloves. If you are going to manipulate the putty for the exam, kindly use the vinyl gloves. Okay. If you are going to use latex, please remove it, dust the powder off, wash it, and then manipulate. Because all these things, small things, the examiner will definitely watch. These are things he will. A large glove.
No, if they get tense, they will.
This is small. 7 or surgical or regular. 7 or things you know. One is the putty index. One is your template. Anything else? What is Beckley's technique? No, the tooth preparation. McLean has, see the other technique is, he said, instead of making all these grooves, you reduce sectional of the tooth, So the other section, for example, you're doing a mesial preparation, the distal acts as a guide. So you know how much of reduction you have done. So that's one technique, very easy. See, all these techniques you can develop on your own. Whether it's a round diamond, or you're going to use the tapering diamond itself, or you're going to use McLean technique, nothing, doesn't matter. But you develop your own technique. The evaluation of the technique is by your template. Whether you use a putty index or use your template. You all use putty index, right? But putty index is very difficult to visualize, no? Sometimes, especially posterior. So you know how to evaluate your preparation. Direct, visual examination, or indirect, right? If you go to indirect, how do you use your mouth mirror? What is the distance between the mouth mirror and your vision? 12 inches, centimeters, feet. It's 30 centimeters, right? So you binocular vision or single eye? Single eye. Because the binocular vision will always parallax error will cause the undercut to be. It will cover up the undercut, right? So always if you use this thing, single eye, okay? Keep your mind, okay?
இதெல்லாம் நான் யூஸ்வலி கற்றுக்கிட்டது இப்போ ரிமைன் பண்ணுற மாதிரி இருக்குல்ல பேசிக்ஸ்லாம்.
டைப்லேயே வெஜிடபிள் ஒர்க்கர்
Okay, with anesthesia work, we will look into the X-ray, okay? So you can see the X-ray, actually the OPG, it looked as if it is curved, it's inclined, right? But in this IOPA, it is almost upright, okay? And you can see the, why it is upright in the IOPA and it is inclined in the OPG? OPG is a parametric, so it circles the mandible from one end to the other end, so you definitely have an error on that. So don't go by that inclination alone, okay? And the trabecular pattern is good, right here. What will signify the trabecular pattern? The trabecular pattern is good in this case. What does it denote? The significance. What is negative and positive index? Bone index? What is negative index? Positive index? No? See, negative and positive index shows the bone reaction to the occlusal load. So, if you look into the Stewart textbook, it will give you. So, when there is an intensive span and the occlusal load is more on the distal abutment, the bone will react with either a change in the trabecular pattern, which the lacunae is created more, is a negative response. So, it's called a negative index. And a positive index is when there is a good trabecular pattern with calcification like this, ossification rather. So that's called a positive index. So positive index is always better than a negative index. Okay.
கரெக்டு. நாளைக்கு நான் சாக்லேட் எடுத்துட்டு வரேன். டெய்ரி மில்க் வச்சு.
So when reducing the enamel in between, then change the angulation because it's not be parallel with the occlusal surface. Otherwise, you will end up with deepening the grooves rather than reducing the.
படிச்சுட்டு கொடுப்போம். ஓகே. இந்த பிஸ்கட்டில் அப்படியே ப்ரெஸ் பண்ணுவேன்.
இருக்கிறியடா
Okay? Cutting them up. You can evaluate for the traction. Okay, medially it's been reduced. Okay? Okay, that's it.
Suction eduma. Right focus பண்ணு. Right focus. நான் full எடுத்துட்டேன்.
Okay. See, the clearance is more on the medial aspect because it's already slightly inclined on the to the medial. Okay. So let's start.
மூணு வந்து ஸ்டார்ட் பண்ணி போய் மலர்லாம் உட்காந்த சக்ஷனை நம்ம சக்ஷன் விஷன் மறைக்குதுன்ட்டு அந்த பொண்ணு முதல்ல செக்ஷன் வச்சிடணும் அதுக்கப்புறமா இவர் ஹேண்ட்பீஸ் இருக்கணும்
அப்படியே பக்கத்தில் போகணும்
இல்லைன்னா அவர் ரிட்ராக்ட் பண்ணுற மாதிரி.
Okay, now I'll move on to the buckle preparation.
ரெண்டு மாதம் பக்கத்தில் ஜாலியாக
ரவுண்ட் அண்ட் டேப்பர்லேயே பண்ணுறாரு ஃப்ளாட் அண்ட் பேப்பர் தானே.
You can go again.
ரவுண்ட் அண்ட் டேப்பர் தான் ஷோல்டர். ரேடியல் ரவுண்ட் அண்ட் பேப்பர் ஆர் மாத்திரை சொல்லுவோம். எனக்கு இது எடுத்து பார்க்குறேன் மாத்திராரா இல்லைடா பாரு அவர் மெஷர் பண்ணுறாரா மவுத்து அது பேர் என்னது மவுத் ப்ரோ. நீங்களும் எக்ஸாம் மவுத் ப்ராப் வைங்க. மவுத் ப்ராப் வச்சு பண்ணுங்க எக்ஸாம். பிளாக் கலரில் இருக்கும் அதை ஆட்டோகிராஃப் பண்ணி எக்ஸாம் முடிச்சிட்டோம். இன்ஸ்ட்ருமெண்ட்ஸ் எல்லாத்தையும் பேக் பண்ணி அங்கே வச்சு தான் எடுத்து போவோம் எக்ஸாம். பாக்ஸ் போட்டு வச்சுருக்கேன். நான் பாக்ஸ் போட்டு நான் என் வீட்டுக்கு எடுத்துகிட்டு போயிடுவேன். நானா நீங்களா உங்கள் கிளினிக்லையா?
Start walking your diamond. Okay. Always have control of your finger rest and watch of your head of the handpiece. Okay. So if I taper it, it becomes excess taper towards the tooth. If I want to maintain it, I maintain the occlusal surface and the head of the handpiece parallel. Only then you will have that taper dictated by your handpiece. Diamond, sorry.
ஆமாம் பாருங்க.
Mark the diamond seam. Make sure you have reduced 0.5 on the cervical region.
அதான் இன்ஃபில்ட்ரேஷன் தான் பண்ணலாம். பிளாக்கு தான் இன்ஃபில்ட்ரேஷன் பண்ணலாம். இல்லை பிளாக் தான் பிளாக் தான்.
Can you see that diamond is, my diamond point is not clipping? Okay. Focus. I'm giving pressure, is still holding there, which means that's a definitive seat prepared. Okay. So that is more than enough for your finish line. Okay. Concentration.
இன்னும் 2 தடவை
And
பண்ணுங்க.
then we start moving on the.
இன்னும் 2 தடவை பண்ணுங்க உள்ளே போயிடும்.
Now again maintain, it's very difficult, you know, the taper can be made this way or away from the tooth, right? So I keep a watch of the occlusal surface and your handpiece. Okay, it should be parallel. Can you see that?
எல்லாமே அவர் டார்பிடோ தான் போயிட்டு இருக்காரு.
ஷாம்பர் குக்கம் பண்ணிட்டு இருக்காரு. ஷாம்பர் பிளான் இல்லை
ஆன்சருக்கு வந்து டார்பிடோ.
ஆக மொத்தம் எந்த இடமும் உருப்படியாக இல்லை அதனால்.
ஸோ ஹெச்ஓடி நான் மாறிடாதுல நமக்குலாம் சிம்டா.
நாங்கள் ஜாயின் பண்ணப்போ தான் பிஹெச்டே முடிச்சிருக்கோம் போயால்.
You may have to change the timing.
ப்ரோஸ்டோக்கா எப்படி
அப்புறமா தான் மேம் வரதுக்கு அப்படியே கலந்து அரிசி என்ன இருக்குது
பாருங்கள் மொபைலில் பாருங்கள். அதுக்கப்புறம் வந்தாங்க.
The crown item lens, you know, use a short shank lens.
மேல் ஸ்டாஃப் அவர் ரொம்ப ஸ்ட்ரிக்டாக.
புதுசாக வந்து அப்யூஷன் பற்றி எடுத்து சொன்னால் நல்லா இருப்பாங்க. அப்யூஷன்
அட்ரிஷன்
நல்லா தான் இருக்கும்.
A definite cervical stop is important. Follow the contour of the marginal gingiva, that is very important. Okay, otherwise contouring and the foot flow will be a problem.
ஸ்ட்ரைட்டாக பிடிச்சி பண்ணுறாங்களா? அப்படி பண்ணிங்க டேப்பராக வருதா இல்லையா?
என்னது
டேப்பராக இருக்குல்ல
இப்படி போகுது.
இல்லை
And go as much as possible slowly towards the proximal surface. Don't break the contact. Okay, the contact has to be broken mechanically. Okay, how do you protect the contact? What are the methods of protecting the contact? You can use a matrix strip, which will that will get trimmed rather than adjacent tooth. And the second thing is to maintain the thin lip of enamel there, which can be mechanically, manually removed with your hand instruments. Okay. So I will show you how to do it. Okay, maintaining the contact. Okay, so now I'm going to shift to the thinner
long
diagonal.
இன்னைக்கு எப்படி வந்தீங்க? பெருங்குளத்தூர் போயிருந்தாங்க. உங்களுக்கு
நான் பெருங்குடி வழியாக தான் பெருங்குடி திருவான்மையூர் நேற்று நான் போனேன் நம்ம டிநகர். இன்றைக்கி நான் கண்டிப்பாக டிநகர் ஸ்பெஷல் 9th 11th கிளாஸ் அப்சல்யூட் காப்பியில் இன்றைக்கி வந்து அண்ணா அண்ணியோட 6 months ஆனிவர்சரி.
இப்போலாம் செலிப்ரேட் பண்ணுறாங்களா?
6 months போயிடுச்சுல எப்படி இல்லை
Most of the examiners not forgive you for touching the adjacent. Okay, don't touch the adjacent. That is also not permitted.
நாக்கே கட் பண்ணுறாரு.
இவனுங்க பேசாமல் பண்ணால் கூட ஒழுங்காக கான்சன்ட்ரேஷனோட பண்ணுவானுங்க.
இன்னொன்று சொல்ல மாட்டேன், அது வைக்கும்போது எடுக்கும்போது ரன்னிங் தான் இருக்கும்.
Blade is wobbling slightly, so it's just changing position. I just showed how to cut. It shows the final model which is already.
நமக்கு பண்ணி வரதெல்லாம் இல்லை, ரைட்டர் பண்ணி தான் வருதா.
This was for just going diagonal.
ஸ்டிச்சிங் கூட வர மாட்டாங்க.
After sectioning, you have to section in 4 regions, one between the first premolar and the second premolar, then for the pontic and the final organ. So 3 pieces, you can remove it into 3 dies individually, then you can proceed with ditching and further wax pattern procedures. So you can see over here, the die section. So this is the first section, which is section, the first premolar and the pontic, and the second one will be the so this will be the second section. And this is the last section. So you can remove it easily, each dice individually, and you can do ditching and then add margin wax and coping wax, etc. Then the dissection should be as parallel as possible. It shouldn't be conical or it shouldn't be converging accussory. Then the retrieval of the die from the model will be very difficult. So the sectioning should be as parallel as possible. If you couldn't section with the dissectioning instrument, you can use saw, hand saw. In case of few preparation cases, the axial clearance will be very less. So in those kind of cases, you can use hand saw to avoid doubts. So you can use hand saw to avoid touching the finish line. So for 3 unit of PD, you need to do 3 sections. In case of 3/8 or 4/8 is present, you have to do another section adjacent to the molar, last molar abutment. Next we will be proceeding with wax pattern.
ஐஸ் பீஸ் எல்லாம் வச்சுட்டீங்க போல.
Yes, quite a lot. Let me discuss about the MdS fibrosis. When pedagogy is also a topic given to me, I would like to do it in the same way. First, prepare the lesson plan. That is, the content should be always played before, so that you will know what are the contents what I am going to discuss about. I will introduce how to crack fibrosis first, then talk about the purpose of the fibrosis, advantages of fibrosis, disadvantages of fibrosis, the type of examiners. Definitely, Viva is not going to end with one way. It's a two-way communication. So you should, as students, assess what type of examiners. When you are sitting for the examiners, you should be able to assess the examiner. what type of an examiner he is. I'll be able to tell you to a certain extent what type of examiners are. Then strategies and skills in presenting the viva and the final advice. So to introduce, I'll just continue. To introduce with the topic where in viva, what do you really achieve after the viva? It is the performance. How are you going to perform for the viva? And to perform.
After checking it, you can just lock it with the magnet along with the cross holder. Then you can switch it on.
அதோட பின்னாடி மெஷ் மாதிரி இருக்கும் அதுக்கு வந்து லாக் அப்படியே வந்து கஷ்டமாக இருக்கும்.
கட் பண்ணிட்டான் டீட்டு கட் இந்த பாக்ஸில் கட் ஒரு டெமோ கூட உள்ட்டே வரல. வார்பிள் ஆயிடுச்சுனா பாயிடுச்சு.
சீஸ் மாதிரி
டை செக்ஷன் அது பிளேடு சைடு பின்வாக வேறு பிளேடு போகணும்.
பாஸ் பண்ணிட்டாங்க.